Welcome back, and thank you for keeping up with our doctor here, Dr. George.
Yeah.
Karibu tena. Now,
Asante.
we want to understand. I know
Yes.
people are anxious out there.
Yes.
Kama kuna mtu kwa familia yako nayo, will I acquire it? Will I get it?
It is rare
Mhm.
because most of the causes, as I have said, are acquired. For example, high blood pressure. For example, a condition that will predispose you to getting a heart attack.
Okay.
The other condition that I talked about, the environment where someone is living. But when it comes to those other rare things, for example, a lady getting heart failure when she's pregnant, or someone getting heart failure because of toxicity, because there are people who drink alcohol and they never develop it. There are a lot of ladies out there who have given birth and they have not developed. But again, their parents of those people again, or they are in their family, they could maybe have not had the same condition. So we don't want to blame heredity on it, but in medicine we say nothing is impossible.
Now, what are the common signs? What are the signs that can detect or show that I have heart failure or it's developing?
One of the common signs is getting shortness of breath especially when you are walking, especially like when you are climbing a steep area like a hill or stairs. You start feeling that you are getting out of breath
so fast.
Yeah, so fast, something that you are not experiencing before. Another thing, you could be having swelling of your feet. Yes, what we call edema. So another thing is coughing. Another thing is when you lie on a flat area, like at night, your breath, you have to wake up and catch some breath. So those are some of the signs, some of the things that you will notice when you are developing heart failure.
So how can you differentiate between normal fatigue and now the heart failure itself? Because the symptoms are too close.
As I said, this is something that will happen continuously. Normal fatigue, maybe you will get that kind of a symptom today, but tomorrow you won't. Yes, but this patient who is in heart failure, they would definitely have those symptoms continuously, and they continue getting worse. The more you delay treatment, the more it gets worse. And one of the things, as you have rightly said, is that those symptoms are the symptoms that someone maybe with pneumonia would prevent with, or a lung condition. So we tend to see some of our patients, or even most of our patients, tend to come to us after they have been treated for chest infection
and
other diseases for quite a while. Someone will come to you, they tell you they have been treated for what we call ulcers, or hyperacidity, chest infection, pneumonias and all that, but it doesn't go away when they take those medications. So yeah.
So how is it diagnosed? Maybe I have come to you. How do you diagnose it?
So first of all, we take a good history. We'll try and deduce those symptoms that I have talked about. You will tell me, you're not breathing well and all that. There are some blood tests that we can do. And then there are these tests right here. One is called an ECG, or electrocardiogram. The other one that now will be able to tell us completely that is your heart failing is called an echocardiogram, which is basically an ultrasound of the heart. And that one is a very good test because we are able to even categorize the kind of heart failure that you have.
So we have different types of heart failures?
Yes, we have different types of heart failures and they are treated differently.
Oh, okay.
Yeah, so in order for us to categorize the kind of heart failure that you have, then we do that test called an echocardiogram. And then we can also do chest x-rays, even MRI of the heart when we go to those other levels. But basically, what can be found in most places, like our place, is an ECG and an echo, and those are sufficient for us to make that diagnosis.
What determines the maybe lifelong condition, whether it's a lifelong condition? You had mentioned earlier about types of heart failure.
Yes.
Can you explain to us what do they determine?
Most of the patients, if not all, who have heart failure will be on medication for life. We rarely do stop all the medication. When it comes to the type, which is a bit technical, but sometimes it's good for patients to know, there are like 3 levels. There is and all these levels are determined by that test that I was talking about, the echocardiogram, whereby we will determine whether it is heart failure, where the heart is not able to pump enough blood to the body because it is weak. The heart itself, the heart muscle, it is weak. And there is a number that we measure with that test. So if the heart is not able to pump for over 40%, normally it's supposed to pump over 55% of the blood that is in it.
Okay.
Yes. But there are people, it pumps below 40% of the blood that is in it. That one we call it heart failure with reduced ejection fraction. That is one type. Then there are those who pump between 40 and 41% and 50%. So those ones are called mid-range. And then there are those ones, yes, they are pumping more than the 50% blood that is in the heart, but in some condition, they are not able to receive enough blood. So they could be even pumping 70%, but the blood that they have refused or received is kidogo sana. Yes, so that one we call with preserved ejection fraction. Yes, they are pumping well, but maybe the blood that they are pumping is too little to satisfy their body demands.
So this brings us to another question.
Yes.
Then it results to different options of treatment.
Exactly.
Can you tell us more about the treatment?
The first one, where the heart is weak and is not able to pump more than 40% of the blood that is in it, there are 4 types of medications that have been studied. And as at last year, even our own, we call them guideline-directed medical therapy, as in these are ways that have been studied and have been shown to work. And then they are written down for us and in what we call guidelines. So there are 4 types of medication that are used, and they really help. They help with the healing of the heart muscle itself, and they also help with reducing the symptoms of that condition. So it is very, very important for our viewers to understand that when we give you those medications, you are going to feel good in about a month or 2. And you feel like you have gone back to your normal self. Yes, that is a good thing. But the biggest mistake that our viewers make and our patients make is they think that they are healed.
Oh, okay.
Like on Saturday again, we had this young man, we had seen him about a year or 2 ago with heart failure. He got better and he stopped his medication.
Oh, okay.
So what happened? He came back to us last week. We did the test and his heart was pumping at 20%.
Very low.
Very low. And this is someone who had started getting better, but they felt that they are okay. And another thing that our people should understand is that those medications sometimes do or not sometimes, most of the time, are the medications, some of them we use to reduce the blood pressure. So you might go to a hospital and your blood pressure is a bit low. You are not symptomatic because of that. Maybe you've gone because you are coughing or something and someone took your blood pressure and it was found to be low, and they tell you that you're on many medication, you should stop. You should never, unless you have come again to us, we have done your test again, and we have seen that there is an improvement. So what happens is either we reduce the doses or we reduce the number of drugs. But at no one time will we, like in most cases, stop all the medication. Yes.
So we've learned about the medication part.
Yes.
Now, at what point can a patient need maybe surgery or a pacemaker or a heart transplant at this stage?
Okay, it will depend. Not all patients will need surgery, but patients with what we were talking about, diseases of the valve, some will have their valves replaced. Patients with holes in the heart, they will need those holes to be closed. Patients who have had a heart attack, sometimes they do go and a surgery is done where you bypass the point where the blood vessel is blocked. You bypass that point and you are able to supply the muscle with blood. So it depends, but not all the patients will require surgery or pacemaker. Pacemaker is another whole topic. Pacemaker, we give it to people with a few conduction condition, because the heart, for it to pump, it also requires some energy or some electricity. In fact, the heart has a generator. It has a generator that releases energy or some low voltage electricity 60 to 100 times, what we call a heartbeat. That heartbeat occurs because the heart releases that electricity or that energy for it to be able to contract. So when there is a condition that is affecting the wiring, because once the electricity is released from that generator, it has to travel to the whole heart, because that generator is found at a specific place. And then there is some very specific wiring that happens in your heart. So if there is a condition that is affecting that, that is when now we come to the issues of pacemaker. There are people whose generation is normal, but the wiring is affected, and that means that their heart is pumping or it is beating at a very low rate. We see patients whose heart is beating at about 30, 34 times a minute, and those are the ones who will put a pacemaker. There are others who have conditions that affect the heart muscle or the generation in the lower part of the heart. And there are some specific generators that are put. So there are even different types of generators or pacemakers.
That's another broad topic that we will need to visit another time. So I think our time today is up, although we have not exhausted a lot of
We have not.
I think we will have a second session of heart failure.
Very true.
Now, before we leave, maybe you could tell our viewer how to get to you and how to get to Mount Kenya.
So once again, our viewers, thank you very much for watching us. As I had said, we are opposite the governor's office in Embu town when you are going towards the Meru side. And when you are coming from Meru, we are opposite Huduma Center. Still opposite the governor's side, but when you're coming from Meru, there is a Huduma Center that we are opposite to. So it's not a place that you can miss.
Yeah, it's very broad.
Yes, and we do check the heart conditions every day. The ECG and echocardiograms, those ones we do every day. We do have cardiologists who come like a day like today on Tuesdays. Every 2 weeks, We have our main cardiologist coming every first Saturday of the month. And also we do have a cardiologist of the children, or the doctors that we call pediatric cardiologist. He comes every first Friday of the month. And we do have cancer doctors who come every 2 weeks on Fridays. And we also offer chemotherapy. We have a laboratory. We have a pharmacy. So most of the heart drugs that are not stocked out there, we do have them.
I hope you have learned a lot and you have learned about heart failure. Thank you very much for keeping up. This is Uvoro TV Business. I am your host, Nyambura Kamau, and this is Mount Kenya and Heart Cancer Center, where you get all your screening done and everything you need checked inside your heart or anything to do with cancer. And again, don't forget, whenever you need an architectural design, we have DreamWorks Investment Limited company as the very best company you need when it comes to architectural design, project planning, interior design, and exterior design. This is the place. Until next time, bye-bye.